Thanks to Nordhaus for sponsoring this video. Okay, so from my perspective, this is a really important video, and so I'm going to start off by doing something I don't normally do. I'm going to try and summarize the whole content of the video into 3 quick points. Get it out of the way so that for you busy people, you can just watch this part and then get on with life. So number 1, physical health and mental health are intimately interrelated. Having physical health illnesses increases the risk of having mental illnesses, and having mental illnesses increases the risk of having physical illnesses, and improving one generally can improve the other in a bidirectional relationship. Okay, that's point 1. Point 2, saunas confer basically equivalent benefits to moderate intensity exercise, but with far less mobility requirements, and for many people, less of a barrier to initiation. So, for someone with chronic pain, it's very hard to just start doing moderate intensity exercise, but to just go into a sauna and get the same benefits could be easier for certain people. And then the third point is safety. So you can't just go into a 80-degree sauna and see how you go. You need to think about it. You need to see your doctor and create an individualized plan and have a discussion as to whether any of your medications or your health status affects your ability to do sauna. Okay, so those are the 3 big points I wanted to get out of the way. Now we can talk about sauna in a bit more depth. So if you're new here, a warm welcome. My name's Dr Syl. I'm a junior doctor from Australia. I'm on the psychiatry training program and I make these videos in a personal capacity. I'm not representing a college or a workplace, and all this advice is general in nature. There's no personalized medical advice here. So when we're talking about sauna, a lot of this information can be educationally used for your interest in education, but you really should talk to your doctor to make an individualized plan. That being said, I've incorporated sauna into my weekly health routine and my life has improved significantly because of it. Subjectively, I have many benefits from it. And so that is kind of why I've wanted to make this video, because I've started using sauna in my own life and I just find it wonderful and I really want to kind of promote it. I also just think how is not every country doing this during winter, having saunas? Like, they're so good for socializing and for other wellness benefits. Like, it should just be more widely used. And I think the Finnish people are really onto something. So the structure of this video will be just to look at the kind of evidence around sauna benefits in health, and then talk about how I've incorporated sauna into my life. And then we'll finish on a discussion around how to safely incorporate saunas, things to think about, especially if you're on medications or if you have mental illnesses or physical illnesses that you need to be aware of. So we'll have a safety discussion and then we'll close the video there. Okay, so do saunas work? Well, the answer is yeah, they do. There's one big prospective cohort study that is probably the most referenced study in terms of sauna effects. And I thought I would just bring up the study because a lot of podcasts talk about the study but don't actually show the study. So if we look here, this is the study that a lot of people reference. It's from 2015, but it's a cohort prospective study. So the title is called, we're not going to go through the whole study in depth. I'm just going to give you a quick rundown so that you get a sense of the evidence. But the title is The Association Between Sauna Bathing and Fatal Cardiovascular and All-Cause Mortality Events. Okay, so this is really a generic health study looking at what's killing people and do saunas reduce all-cause mortality. So yeah, it's 10 years old, but since this study has been published, many other studies have followed on looking at this data and new data and have supported the findings a lot strongly. So I guess the rundown of this study is that it's over 2,000 participants and that they were followed up over 20 years. Their ages were between 42 and 60, and they basically just looked at their characteristics. So how often they saunaed, and then their all-cause mortality and other health metrics. The kind of abstract, quick summary conclusion is that increased frequency in sauna bathing is associated with a reduced risk of sudden cardiac death, coronary heart disease, cardiovascular disease, and all-cause mortality. But the power of this study can all be seen in one kind of convoluted table. So let me show you this table to just really look at this data. Okay, so the way to look at this table is essentially we have these columns, and yes, I'm drawing with a mouse. So look at these columns, 1, 2, 3, and 4, and that separates the different kind of types of outcomes they're looking at. And then we have this very important row separation from the age-adjusted hazard ratios and the multivariable adjusted hazard ratios. So to simplify this table even further, I think we just look at this bottom section, okay? Just here, all right? And what we're looking at is the multivariable adjusted hazard ratios, which is a mouthful, but let me simplify what that means. That means, okay, first of all, what's a hazard ratio? That is the risk of something happening in a treatment group as compared to a control group. So in this study, they were comparing the risks of these different outcomes. So let's just look at all-cause mortality. Okay, we're just looking at this row. They're looking at what was the risk of all-cause mortality in the groups of people who saunaed 2 to 3 times a week or 4 to 7 times a week as compared to the control group, which was people who saunaed only once a week. Let's take a little pause here because this was kind of funny. In Finland, people sauna so frequently that this study wasn't able to find a control group of people who didn't sauna at all. So they had to use people who saunaed once a week as the most kind of, well, the control group, the people who, I mean, ideally you would have had a group of people who don't use sauna to see the effects of sauna, but they couldn't even get enough people to fill that out. So they had to use once per week sauna users. It's one of the limitations of this study, but it's pretty funny that that's how frequently people sauna in Finland. I think the ratio of saunas in Finland is 3 people to every 1 sauna that exists. And it's very common in Finland to have a sauna in your own home. So anyway, funny side note there. So anyway, we're looking at the hazard ratios, which is the risk relative to the control group. But what's super powerful here is that it's multivariable adjusted, okay? That means that they are adjusting, let me get a highlighter here. So that means that they are adjusting for age, BMI, blood pressure, cholesterol, smoking, alcohol use, previous heart disease, diabetes, cardiovascular fitness, resting heart rate, physical activity, and socioeconomic status. So we can't just say that, oh, it's the people who sauna more who are richer or who have lower BMI or who have better blood pressure, and that those are the factors that explain why they're not having as high all-cause mortality, because all that is being controlled for in this analysis. All right, so what did they find when they controlled for everything? Well, not everything. When they controlled for many variables, what did they find? They found that the hazard ratio in people who saunaed 4 to 7 times a week was 0.6, right? What does that mean? That means there's a 40% reduction in all-cause mortality as compared to people who sauned once a week. That's pretty profound. So just saunaing 4 to 7 times a week, so sitting in a sauna for 20 minutes, and I think in this study it was, I can't remember if it was 60 or 80 degrees. I'll put a little bubble there. But just doing the sauna reduced their risks of dying by 40%. Whoa! Not only that, but that reduced the risk of dying compared to people who sauned once a week. So if you're to extrapolate a little bit, it's probably even more compared to people who don't sauna at all, which is most people in non-Finland countries. So I think, in the next 10 years, sauna is going to be much more common as this data gets stronger and stronger. And the data in this study also shows that even, for fatal cardiovascular disease, it's a 50% reduction. For coronary heart disease, 48% reduction. And then for sudden cardiac death, it has a very profound effect. So it's 0.37. So people in this group so it's 0.37. So there's a 63% reduction in risk in this group for sudden cardiac death. So it just kind of makes you live longer. It reduces your risks of death by a lot. And I think that that's a really positive effect of sauna. So you might be saying, look, Syl, great, it has physical health benefits, but this is a mental health channel. Like, why are we talking about physical health benefits on a mental health channel? And it comes back to that point I made at the start. They are connected. Look at the rates of depression in all these different physical health illnesses. So the average 60-year-old person has a rate of depression, let's call it around 10%. Okay, that's just according to the CDC, and that's American data. In all these physical health conditions, the rate of depression is basically doubled. So after a stroke, it's around, let's call it 27%. After a heart attack, it's 20%, or between 15 and 20. Type 2 diabetes, if it's uncontrolled, it's 20 to 30%. Dementia, it goes up, and in uncontrolled blood hypertension, it goes up. So depression is increased in a lot of these physical health disorders, and so if we can improve them and improve depression, it's a good thing. So if you look at sauna and you compare it to things like exercise interventions, healthy diet interventions, it essentially has equivalent impact on all-cause mortality. So when we're making physical health plans to optimize physical health, we should be talking about healthy diet. We should be talking about enough exercise. We should be talking about healthy sleep, but we should also be considering heat and cold exposure. Now, we're not talking about cold exposure in this video, but sauna especially. So what's the takeaway from what we've spoken about so far? Number one, if you can sauna 20 minutes at a time at about 80 degrees, about 4 times a week, you will very likely have improvement in physical health and in mental health outcomes. The way to go about this is you can look up your local gyms and pools and ask them if they have a sauna. Just remember, a sauna and a steam room are different, okay? So a steam room does not get as hot as a sauna. It's just steam in a room. I don't know anything about it, but I don't think it's as good. Now, if there is no sauna near you, you can do what I did, which is save up for a home sauna. And this brings me to the sponsor of this week's video, which is Nordhaus. Nordhaus is an Australian-owned sauna and cold plunge therapy company. They sell home and commercial saunas. They have a 2-person, a 4 to 6 person, and it comes as traditional and infrared, and they have heaps of cold plunge options as well. So I got the 2-person traditional sauna and I've loved it. It comes with a 4.5 kilowatt heater in a small 2-person sauna volume, which means it heats up heaps. It actually heats up more than I can tolerate, which is pretty impressive for a home sauna. Gets to 90 degrees, my one does at least. And that's in winter when it's cold. So I don't know what to expect when it gets to summer, but you can always turn the thermostat down. The 2-person one is very comfortable. It's nice to do alone or with a friend. And my favorite thing is to use it first thing in the morning. So I put the timer on when I go to bed. I have it heat up for about an hour before I get into it in the morning. So I usually get into it at around 6 a.m. and I time it so that the heater starts at 5 a.m. and then I go in, I have heaps of water and electrolytes before, and I go through like 2 liters while I'm in there, and I do 2 sessions of 20 minutes at around 80 degrees. I love putting that water on the hot stones, listening to the sizzle, having that like steam go deep into my lungs. And honestly, I just find it so nice to wake up without like being stuck on my phone. It just gets you off of technology. You can't actually bring a phone in there because it'll be too hot for it. And it just keeps you connected with your body. Now, I know these things aren't cheap. I saved up for mine. I think it's well worth it. My argument is that if it makes you live 1 year longer, then all you have to do is make that amount of money in a year and it's commercially viable. So, you make your decisions, but having a more expensive car compared to a less expensive car doesn't make you live longer. Doing sauna 4 times a week probably does make you live longer, so it's a well worthwhile investment. Now, you have to also think about electricity costs when you're doing your own sauna. I've used ChatGPT to estimate mine, and for me it costs about $3 to $4 for 2 hours of use on an off-peak grid time, and that's well worth it for me because it's $30 to $50 to use it privately in a gym. The one that's closest to me that's realistic was $30 to $50 each session, so this saves a lot of money, and if I use it long term, then it'll pay itself off as well. So a massive thank you for Nordhaus for helping me incorporate sauna into my daily routine. All right, now for a very important section of the video, and that is safety. We need to talk about considerations here. So let's talk about sauna safety. The first thing to acknowledge is that people have died from exposing themselves to extreme temperatures. There used to be a competition in I think it was in Finland, where they kind of were competing to see who could last longer in higher temperatures in saunas, and someone died, maybe 2 people. and the competition was cancelled. But the point is that extreme exposure to extreme temperatures is risky. So this isn't about causing health risks. This is about putting your body under stress, overcoming that stress, and then feeling better afterwards. There are certain populations that need to be very cautious with sauna and definitely need to speak to their own doctors before doing it. People who are pregnant, because there is evidence that if a core body temperature is over 39 degrees, that it has a teratogenic effect on the fetus. People who have had recent heart disease, like a recent heart attack or coronary artery disease, need to speak to your cardiologist or your GP if they're comfortable to talk about the risks and benefits of sauna for you. People who have substance use disorders or drink heavily alcohol, that you can have impaired thermoregulation. So the ability to control your body temperature is impaired, and so it's very risky to put yourself in a high temperature situation. So you need to talk to your doctor. And anyone with like electrolyte issues or renal issues needs to be reviewed because you sweat so much sodium out, and it can cause electrolyte abnormalities in people who are predisposed. So you need to be very cautious there. It's important to note that the older someone is, the lesser they are able to handle heat stress efficiently. So there are increased risks that come with age. Now, if you are on certain medications, you need to be more cautious. There are medications that affect your ability to manage heat, essentially. So things like diuretics or ACE inhibitors or beta blockers or vasodilators. These are medications that change your ability to feel thirst or excrete or make you cause dehydration or affect your ability to contract blood vessels enough when needed. So, can increase the risk of fainting and things. And I guess, as a final point, just speak to your doctor about doing sauna for you. So how to start, I guess another final point to appreciate is you don't just go straight to 20 minutes at 80 degrees, guys. You need to build up slowly, just the same way you would build up with exercise. You need to acclimatize to heat tolerance. And I think, if at any point you're getting lightheadedness, I think that is really just have a low threshold to leave the sauna and cool down. All right, well, I think that covers everything I wanted to talk about in this video. So very strong evidence that it's good for physical health. As I said, physical health and mental health very strongly connected, so definitely has likely benefits to mental health as well. Really important to talk to your doctor before getting into the sauna. If there's any health conditions or any concerns you've got, make sure you talk about them with your doctor. And if you have any questions or reflections or experiences you want to share about how sauna has helped your life, please leave them in the comments below. I'd love to read them. And other than that, I just wish you all a wonderful day. And again, thank you to Nordhaus for sponsoring this video. Please go check out their website and have a look at their deals. I think Nordhaus has the best value saunas. So they're not the most expensive, they're not the cheapest, but they've got the best quality for the price of all the saunas that I looked at. And I looked at a lot of saunas before purchasing theirs. Think about looking at Nordhaus. All right, bye for now.